Hello, my name is Dr. Johal, and I'm the owner of Family Dental Center in Guelph, Ontario. I specialize in airway dentistry and tongue and lip tie releases. I'll be answering the most frequently asked questions about baby tongue ties. The number one most common question I'm asked is, how do I know if my baby has a tongue tie? Some common signs in infants include breastfeeding difficulties, poor latch or difficulty maintaining latch, clicking or smacking sounds while nursing, frequent feeding every 1 to 2 hours with little satisfaction, prolonged feeding sessions, 45 plus minutes, excessive gassiness or reflux, poor weight gain or failure to thrive, falling asleep at the breast from exhaustion. Physical signs in babies include heart-shaped tongue when crying or sticking the tongue out, inability to lift the tongue to the roof of the mouth, tongue movement side to side rather than up, inability to extend tongue past the gum line or lower lip, white coating on the tongue that doesn't wipe away from milk pooling. Maternal symptoms include painful, damaged, or creased nipples, nipple blanching, turning white after feeding, incomplete breast emptying or recurrent mastitis, low milk supply due to poor milk transfer, extreme fatigue from constant feeding demands.
Another question that parents often ask is, how does a tongue tie affect bottle feeding? Even bottle-fed babies experience difficulties with tongue ties, including taking excessive time to finish bottles, 45 plus minutes, milk dribbling from the mouth during feeding, chomping or chewing on the nipple instead of sucking, preferring faster flow nipples to compensate excessive air intake, causing gas, reflux, and colic, frequent breaks during feeding. Parents also ask, should I have my baby's tongue tie assessed even if breastfeeding seems okay? Yes, absolutely. We strongly recommend having your baby assessed by both an IBCLC, International Board Certified Lactation Consultant, and a tongue tie release provider even when breastfeeding appears to be going well initially. Here's why. For breastfed babies, sometimes a mother has an excellent letdown reflex and abundant milk supply that compensates for a baby's poor tongue function in the early weeks. However, around the 3-month mark, supply often decreases because the baby's inefficient suck cannot adequately stimulate continued milk production. What seemed like successful breastfeeding can suddenly become problematic with concerns about supply, weight gain, and nursing frequency emerging months into the journey. For bottle-fed babies, even if your baby is gaining weight appropriately on the bottle, it's crucial to have an IBCLC assess whether your baby is taking the bottle with proper oral function. Weight gain alone doesn't tell us if the baby is feeding efficiently or developing healthy oral motor patterns. Poor feeding mechanics can lead to issues with transitioning to solid foods, speech development, dental and jaw development. Sleep and breathing function is what matters most. The presence or absence of immediate feeding struggles doesn't tell the complete story. A comprehensive functional assessment evaluates how well the tongue, lips, and oral structures can perform their intended roles. Not just whether the baby is surviving, but whether they can thrive with optimal oral function. Early identification and treatment prevent downstream complications in feeding, speech, dental health, and airway development.
An important question I'm often asked is, how is an infant tongue tie diagnosed? For infants, we look at function. Functional assessments consist of observing a full feeding session, checking suck strength and coordination, assessing tongue range of motion during various movements, evaluating compensatory patterns, parent-patient symptom history review. Next, I'll be going over our scheduling process. When should I schedule a procedure? As soon as breastfeeding difficulties are identified. Early intervention prevents weeks of painful nursing for mother, poor weight gain for baby, and potential breastfeeding relationship breakdown. There's no too late for treatment, though earlier intervention typically yields easier adaptation and prevents secondary problems. How do I schedule a consultation? Contact Family Dental Center Guelph to schedule a tongue tie assessment. During your consultation, we will take a comprehensive history, perform a thorough oral examination, observe feeding for infants, discuss symptoms and functional limitations, review treatment options and expected outcomes, answer all your questions, provide information about the procedure and aftercare. No referral is necessary to schedule your assessment. What is recovery like? In infants 0 to 6 months, they may be fussy for 24 to 48 hours, can typically nurse immediately after the procedure. Acetaminophen can be used for comfort if needed. Stretching exercise is required 4 to 6 times daily for 2 to 3 weeks. How quickly will I see improvements? Results vary by individual and the issues being addressed. For breastfeeding, many mothers notice immediate improvement in latch and comfort. Full improvement typically occurs over 2 to 4 weeks as baby learns to use their newly mobile tongue and any oral motor dysfunction resolves. For bottle feeding, improvements in feeding efficiency often occur within the first week. For speech, it may take weeks to months, especially if speech therapy is needed to retrain muscle patterns. Younger children often see faster improvement. For sleep and breathing, this often improves within weeks as the tongue can better position itself in the mouth. For dental and jaw issues, consist of long-term improvements as facial and dental development proceeds more favorably. When it comes to feeding after the release, here are our most common questions. Will my baby need to relearn how to feed? Sometimes, yes. Babies who have compensated for a tongue tie may have developed dysfunctional feeding patterns. After the release, they need to learn to use their tongue correctly. This is why immediate improvement isn't always seen. The baby needs time to develop new motor patterns. Working with a lactation consultant or feeding therapist can be extremely helpful during this transition. Should I see a lactation consultant? For breastfeeding difficulties, absolutely. A skilled IBCLC, International Board Certified Lactation Consultant, can assess latch and positioning, identify tongue tie symptoms, provide pre- and post-procedure support, help you and baby optimize feeding technique, address supply and pumping concerns, support the breastfeeding relationship. Many feeding issues can be improved with lactation support alone, and even when a release is needed, lactation support significantly enhances outcomes. What if my baby still has difficulties after the release? Here are some things you can do if symptoms persist or don't improve as expected. Make sure stretches are being done correctly and consistently. Lack of stretching is one of the most common reasons for reattachment or poor outcomes. Work with a lactation consultant to address any feeding technique issue. Consider body work if not already incorporated. Evaluate for other contributing factors, including reflux, oral motor dysfunction, and allergies. Follow up with your provider to assess healing and ensure complete release. Speech or feeding therapy may be beneficial for older children. Thank you for exploring more about tongue ties. I hope you found this video helpful for both your baby and your family.